Hi, everybody. I hope your studies for Naplex are going well. Today, I wanted to bring to you anxiety disorder and the treatments, and I wanted to bring to you in the simplest way possible. One of the biggest things about Naplex is understanding how to how to choose the best answer choices depending on what you're given. So, like a lot of people have mentioned, the answers are not going to be too far from. I mean, they're not going to be too confusing that you're able to identify the answer. But anyway, let's get into talking about anxiety. So for anxiety, some of the diagnostic criteria are the patient has to have at least three of these symptoms, and the symptoms may must have it. The patient must be experiencing the symptoms for at least 6 months. So number one is having restlessness. Number two is having difficulty concentrating or focusing. Number three is having irritability. Number four is insomnia. Number five is fatigue or feeling tired. Number six is feeling tense, so the muscles are tense. So let's dive into the meat and the bones of treatment, which is what the pharmacist does. So we have to understand the medications that are utilized for anxiety. So, for instance, we have the first line, which is going to be the SSRI and the SNRIs, which is the um, serotonin reuptake inhibitors. And then the other one is the serotonin norepinephrine reuptake inhibitors as well. So for these classes, you have to know your brands and generic. So SSRIs are escitalopram, brand name is Lexapro, fluoxetine Prozac, paroxetine Paxil, sertraline Zoloft. SNRIs are the duloxetine Cymbalta, venlafaxine XR, Effexor. So those are just two mainly in that class. And then the second line that I utilize is buspirone, the TCAs. And on special occasions, we have the benzodiazepines, which is mostly used for acute anxiety. And it's also used for bridging therapy of short time before the SNRIs and the SSRIs kick in. For example, we know the SNRIs and the SSRIs takes about 4 to 6 weeks before they actually start feeling before the patient starts feeling a change while taking this medication. So if the patient is having chronic anxiety and they really want to have that, they want to feel better as quickly, then they can utilize the benzodiazepines. The beta blocker that's mostly used is propranolol, which is for stage fright. If someone is about to go give a speech and then they're feeling nervous or feeling anxiety, then they're given the propranolol. So when it comes to the exams, how do you choose what medications to give and which one not to give? For instance, when it comes to, like we mentioned, the SNRIs and the SSRIs are used for long term. They're first line when being utilized for anxiety when the patient is having chronic anxiety, and they're also used long term. Buspirone is an add-on therapy. They, if the patient has been on an SSRI and probably switch to an SNRI and those do not work, or probably they have an SNRI that's working but they need a little bit more medication to help boost them up. Once the titration of the medication has been titrated and they need another medication, then buspirone is added. So buspirone is almost like an add-on therapy. The benzodiazepines are going to be utilized when there's acute anxiety, like we know the famous one, the Xanax, or when the patient is having panic attacks. But this is going to be specific. You have to look for the word acute anxiety or chronic attacks, long term treatments, chronic anxiety. Like that's going to be the cue that's giving you that you need to choose, you need to choose a medication from one of these classes. Further into buspirone, the mechanism of action for buspirone, I found this question to be very interesting because when I was working through and studying my own, doing my own personal study, I was a little bit, mixed up because I thought buspirone. Anyway, never mind. So buspirone mechanism of action, it's a partial agonist. It's a serotonin A1 partial agonist. One big thing about this, it's a substrate. And that means that the inducers will be decreasing it, inhibitors in it will be increasing it. So we are not to give buspirone with an MAOI, and it takes about 4 weeks to work. So that's what it is. So it does not have any reactions or any actions at dopamine or norepinephrine receptors, and does not selectively inhibit or react. It does not selectively inhibit the reuptake of serotonin. All it does, it's a partial agonist for serotonin A1. So going over this once more is we have majorly the SNRIs, SSRIs, buspirone, TCAs, and benzodiazepines, and the beta blocker propranolol. So when it comes to a patient having acute attacks or panic attacks and they need something to help them right away, then they can have the benzodiazepine. Also, when they're bridging a therapy, if they're going to be long term on SNRIs or SSRIs and they need quick relief before the 4 to 6 weeks, then they can take a benzodiazepine. When they have been on an SNRI, an SSRI, and they need another medication to help them feel better or improve their mood or symptoms, then they can add the buspirone. So some of the things I've seen about the TCAs is I think it's the clomipramine, which is used for OCD. But this one mostly, it's technically just really depends on the question as it comes. But for now, just understand this question, understand this principles, and then go ahead and work on questions to see how these questions or these answers or how to choose SNRIs, SSRIs, buspirone TCAs, benzodiazepines, and beta blockers. Other than that, just if you have any questions, let me know. Leave a comment, like, subscribe. And if you have any topics that you want me to cover, just let me know. Thank you.